Price, good to see you again. South Carolina launched the nation's first statewide Pay for Success project with nurse-family partnership with the use of Medicaid funds. 20% of the babies born in South Carolina are born to first-time low-income mothers. We also have a much higher than average infant mortality rate. Nurse-family partnership is an evidence-based and has already shown real results, both in the health of the mother and the babies, but also in other aspects of the mother's life, such as high school graduation rates for teen moms and unemployment rates. What are your thoughts on incorporating a pay-for-success model to achieve success metrics?
Well, it sounds like a great program that actually has the right metric, and that is the quality of care and the improvement of lives. As you state, if it's having that kind of success, it probably ought to be put out there again as a best practice for other states to look at and try to model.
Yes, sir. Thank you. I believe you were the director of the orthopedic clinic at Grady Memorial Hospital in Atlanta.
I was.
You just mentioned something that I think is very important. I believe Grady Hospital had the highest level of uninsured Georgians. You talked about having coverage, but really not access. Can you elaborate on how your experience at Grady may help inform you and direct you as it relates to the uninsured population?
Well, it was an incredible privilege to work at Grady for the number of years that I did, and we saw patients from all walks of life and many uninsured individuals, and they come with the same kinds of concerns, the same kinds of challenges that every other individual has, and one of the they have an additional concern, and that is somebody going to be caring for me? Is somebody going to be able to help me? And that's why it was so incredibly fulfilling to be able to have the privilege of working at Grady and assisting people at a time when they were not only challenged from a healthcare standpoint, but challenged from a concern about whether or not people were going to be there to help them.
Yes, sir. I know that you're aware of the Title I of the Every Student Succeeds Act. It allows for the population of Head Start to have access to resources. It seems to me that would be imperative for the Secretary of HHS and the Secretary of Education to look at ways to synergize your efforts to helping the underprivileged student, underprivileged child. Can I get your commitment that you'll look for ways to work with the Secretary of Education where it makes sense to help serve those students? You know, we have Head Start under you and other programs under ESA. It'd be wonderful for us to take the taxpayer in one hand, the child in the other hand, and look for ways to make sure that they both win.
Yeah, you've identified an area that is a pet peeve of many of ours, and that is that we don't seem to collaborate across jurisdictional lines, not just in Congress, but certainly in the administrative side. And so I look forward to doing just that, and having as a metric how are the kids doing?
Yes.
Are they actually getting the kind of service and education that they need? Are they improving? Are we just being custodians? Are we just parking kids in a spot, or are we actually assisting in improving their lives and able to demonstrate that? And if we're not asking the right questions, if we're not looking at the right metrics, then we won't get the right answer that allows us to either expand what's actually working or to modify it and move it in a better direction.
I think that's one of the more important parts of your opportunity in this position is looking at those kids. I know that you know as well as anyone as a doctor that those ages, before you ever get into, pre-K or kindergarten, the development of the child between those first 3 or 4 years are powerful opportunities for us to direct one's potential so that they maximize it. And sometimes we're missing those opportunities. We think that somehow the education system will help that child catch up, but there are things that have to happen before they ever get in the education system. So I thank you for your willingness to work in that direction. My last question has to do with the employer-sponsored healthcare system that we're so accustomed to in this country that provides about 175 million Americans with their insurance. In my home state of South Carolina, of course, we have about 2.5 million people covered by their employer coverage. If confirmed as HHS Secretary, how would you support American employers in their effort to provide effective family health coverage in a consistent and affordable manner? Said differently, there's been some conversation about looking for ways to decouple having health insurance through your employer.
I think the employer system has been absolutely a remarkable success in allowing individuals to gain coverage that they otherwise might not gain. I think that preserving the employer system is imperative. That being said, I think that there may be ways in which employers, I've heard from employers who say, if you just give me an opportunity to provide my employee the kind of resources so that he or she is able to select the coverage that they want, then that makes more sense to them. And if that works from a voluntary standpoint for employers and for employees, then it may be something to look at.
That would be more like the HRA approach, where
Exactly.
the employer funds an account and the employee chooses the health insurance, not necessarily under the umbrella of the employer specifically.
Exactly. And gains the same tax benefit.
Yeah. Thank you, Mr. Chairman.